Hi, and welcome to another edition of Your Health with Dr. Christy. My name is Dr. Christy Reisinger, and today I'd like to share some updated and recent studies on blood pressure control, pain medications, and depression. Every year, the American Family Physician Journal publishes the top 20 research studies with enough data to actually change practice habits. They're called POEMS, or Patient-Oriented Evidence That Matters. I'll put a link below in the description for you to read the poems from 2018 and 2019. They're usually published in May for the studies for the year prior. They're excellent and interesting to read. I thought I would share just a few today over the topics of blood pressure control, pain medication, and depression. First, which is a better predictor of true blood pressure measurement? Is it in the office or at home? Well, this study answered at home. And these blood pressures tend to be lower, likely due to factors like white coat hypertension and the stress of getting to the office or taking the blood pressure the moment you sit down instead of waiting like what is recommended. I strongly recommend that you buy an automatic blood pressure cuff and check your blood pressure a few times a week at different times of the day. Be sure to get an arm blood pressure cuff because the wrist blood pressure cuffs aren't as accurate. But checking your blood pressure at home is such valuable information for your doctor, and it may actually prevent you from being put on blood pressure medication because the difference between the office and home blood pressure measurements were about 19 millimeters mercury in the systolic and 11 millimeters mercury in the diastolic. This is significant. And again, in the area of blood pressure, I'm often asked, when is the best time to take blood pressure medication? Well, it's in the evening. Another study followed over 19,000 patients, and the nighttime medication group had a 45% decrease in myocardial infarctions or heart attack, coronary revascularization, heart failure, ischemic stroke, hemorrhagic stroke, and cardiovascular death. Wow! Of course, talk with your doctor before you change, but if you take once a day blood pressure medication, I would recommend taking it at bedtime. Now, let's move on to the category of pain control. The opioid epidemic is a huge problem in America. Did y'all know that 128 people die every day from an opioid overdose, from either prescription or illicit opioids? Doctors are continually looking at our prescribing habits, especially with pain medications. And in medical school and residency, I was taught that opioids like hydrocodone or Norco, codeine, oxycodone or OxyContin, and morphine were superior pain-controlling medications in all situations. But as we get more data, this continually is questioned. And one POEM study asked, are opioids always better for arthritis pain? And the answer is no. Opioids are not better than non-opioids for back, knee, and hip pain from arthritis. This study had 240 patients and placed them into two groups. The opioid group was given immediate release opioids with an escalation to sustained release opioids and finally to transdermal fentanyl if needed. Titration continued to a maximum daily dose of 100 morphine equivalent milligrams. And the patients in the non-opioid medication group started with acetaminophen, also known as Tylenol, and non-steroidal anti-inflammatory medications such as ibuprofen or Advil or naproxen, also known as Aleve, with step-up as needed to adjuvant oral medications such as amitriptyline, gabapentin, and topical analgesics such as capsaicin, lidocaine, and finally to something called Lyrica or tramadol if needed. After 12 months of follow-up, there was no difference between the groups in function, and pain intensity was actually lower in the non-opioid group. What a fascinating result. Well, what about opioids in acute musculoskeletal pain? Aren't opioids better? They're often given in the emergency room for acute pain. Well, no. The second study was of 411 adult patients in the ER with musculoskeletal pain bad enough to warrant an X-ray to rule out a fracture. They were placed into 4 groups for pain medications and were asked about their pain on a scale of 0 to 10. There were 4 groups. The first group received ibuprofen 400 milligrams plus acetaminophen 1,000 milligrams. The second group received oxycodone 5 milligrams plus acetaminophen 325 milligrams. The third group received hydrocodone, 5 milligrams, plus acetaminophen, 300 milligrams. And the fourth group received codeine, 30 milligrams, plus acetaminophen, 300 milligrams. And interestingly enough, the pain reduction was the same at 1 and 2 hours between all groups. This is just another study that continues to prove opioids are used too often and often without good reason. And finally, let's move on to depression. One study asked, is there anything that can prevent depression? And interestingly enough, yes, it's exercise. This was a huge study of almost 267,000 patients without depression at baseline, and they were followed for a mean of 7 years. The study showed that people with high physical activity, defined as more than 150 minutes per week of at least moderate intensity activity, were 20% less likely to go on to develop depression than those who had low levels of physical activity. This is just further evidence that exercise is a great form of preventative medicine. Thanks again for joining me, and I encourage you to read the POEMS studies for yourselves. Thanks again.